If you remember one sentence from this whole episode, remember this one. Waiting until you feel like you're falling apart is not a menopausal plan, okay? It is regret in progress. Today, I'm going to give you 7 things to do the moment you suspect you are entering menopause. Not 7 things for you to go Googling at 2 a.m. in the morning because you cannot sleep. I say this to you with love because I know how you are. How do I know? Ask me how I know. Okay? Alrighty. So these are 7 things for right now in order for you to start today. I want to welcome you guys back to this podcast. I'm Dr. Tamara Beckford. I am board certified physician and founder of Truly Balanced Wellness Care. Now, I know I spend my days helping women to get real answers about what's going on in their bodies. This solo episode is a foundational one, okay? I want every woman to hear this, and I want you to realize, and I want you to just be able to grasp these 7 nuggets that I'm about to post here for you guys. I want you to listen and grasp it so they can help you, right? Because you know what the truth is? Most women, we can't wait. We can't wait until the hot flashes starts to come and become unbearable. You know, we don't want to wait until you go in this room and you can't remember why in the world did I go in this room in the first place. And I don't want you to wait until it hurts when you're having intimacy with your partner to the point that you don't even want it anymore. You know, by the time you do all of that, for some women it's months, for some women it's years. Years of their lives they could have spent feeling like themselves, but it ends up being lost. And this window of time is lost where we could have been able to prevent or could have had an easier transition into what this phase is in the midlife process in our women going through menopause and perimenopause, right? So let's get started. I'm going to give you, like I said, these 7 things I actually want you to know, and I also do with my own patients. So grab a notebook if you need to. If you are driving, know that, this recording, you'll be able to listen to it again. This episode is here for you. Let's go. All right, so number 1, I want you to start having the conversation about hormone therapy now. Now, I know you guys are thinking like, dang, Dr. Beckford, did you just go straight into hormone therapy? I said the conversation of it. Not that I'm saying that you need to start hormone therapy immediately. I want you to have the conversation because you just need to be able to at least understand what's going on and to be able to just talk about it to decide if this is right for you or not. Now, it's a conversation. It's not a definitive plan that you're making immediately. I mean, I've been conversing about wanting to go to Japan. I've been putting it together. At least I still haven't been to Japan, right? Because I'm just having the conversation. It's the conversation. But it's important for you to have that. Now, when your symptoms are bearable, you don't want to wait until it's unbearable when you can't even think about it. Now, here's why timing matters, especially clinically, not just emotionally. Hormone therapy can help to prevent some of those symptoms that you're having, right? It tends to have more favorable benefit and a safety profile when it's started within 10 years of your final period, or like we said, before age 60 or so. But within that perimenopausal phase, that 10 years, you can have a favorable profile if you're starting it then. That's the timing hypothesis, right? It's supported by a lot of menopausal ideas and a lot of menopausal medicine out there. But just having the conversation and knowing what's available from the hormone standpoint is important. Waiting does not make it safer. In many cases, for some women, it might take a few conversations before you feel comfortable. And if that's it, but you should at least be able to start having the conversations. So if you're in perimenopause right now, today's the day to bring that up with your provider. Not necessarily that, like I said, you're going to start a medication now, but just open your mind to it. Have them talk to you about your options while they're available, while you're still at the point where you can make this decision without feeling like you're in desperate need of help, like right now, because you're at least making that decision from a position where you'll feel more informed, and it's so important because I know a lot of women feel like they need to earn this therapy. First, you need to suffer, but you don't. You're allowed to be proactive about this in your own body, okay? So it's okay to start the conversation. Number 2, vaginal estrogen. Now here's something that you're like, what? Vaginal estrogen? Now here it is. Almost nobody talked about this at the dinner parties. But back in 2025, the American Urological Society, they released some new guidelines. And they developed that along with the pelvic health and the urogenital reconstructive people, like all the people that takes care of us down there. And they've confirmed what menopausal medicine has been saying for years, that low-dose estrogen is both effective and safe and is now considered a first-line therapy for genital urinary syndrome of menopause. Now, we've talked about genital urinary syndrome of menopause before. That's what we're talking about, the vaginal dryness. That's the irritation. That's the painful intercourse. That's the recurrent urinary tract infections that comes with the decline in estrogen. So if you're dealing with recurrent urinary tract infections in the midlife, it might not be bacterial only. You might need to pump up that vaginal flora. And that's what the vaginal estrogen has been shown to do. And I mean, there's real evidence behind this. It helps to reduce infections. It helps to bring back the moisture. It helps to plump back that tissue, because that tissue in that vaginal area, literally, we know all this time, the receptors there are very, very, very estrogen prone. So once we start losing the estrogen, that's where all that dryness comes from. So start talking about vaginal estrogen. I know people, trust me, right? So here's what makes this different from the systemic hormone. So the vaginal estrogen, it works locally. And that means that, more women were candidates for that, including women who choose not to take systemic hormone therapy. You can use this locally in the vaginal area and be able to get the benefit and the protection from it. So that's number 2. Start talking about it. Talk about it with your provider. Alrighty. Number 3, protect your heart. Now, know that when we're talking about the hormones in this midlife period, we as women, we need to realize that we are now at increased risk for heart disease, right? And this one right here, protect your heart and not just your hormones, is one of the things that get buried under the hot flashes, the mood swings, and often we forget to pay attention to the heart. Here is the part that nobody tells us, especially women, you're around like 45 years of age. Heart disease is the leading cause of death in women, period. That menopausal transition is a major inflection point for the risk. So as the estrogen starts to decline, cholesterol tends to rise. Some of you guys might be noticing that, and all of a sudden your blood work is showing that you have high cholesterol. You're like, but I'm not eating any different. I'm still exercising. I'm still doing all the things that I used to do. Why is my cholesterol going up? The estrogen is declining. That's what's happening, right? So now you start to probably notice, some of you with blood pressures are starting to climb up. You're noticing some shift in the fat distribution in your body towards the abdomen or the belly section. So all of that happens. Your blood starts to become more lax. Your blood vessels become more lax and loose because the estrogen is not there. And so the flexibility is lost. And the American Heart Association, they've actually shown and studies that this is something that gets often ignored in us women in this midlife portion, which is the importance of heart protection. And the number of the women that are going through this process of midlife transition and not protecting their heart is like an astronomical amount. And it's not because we're like, oh, we don't care. No, it's because we're not aware of this, right? So the research found that women who go through natural menopause before age 40 have a roughly 40% higher lifetime risk of coronary artery disease compared to women who go through menopause later. So the earlier you're going through menopause, the higher your risk of heart disease. And also some researchers found that women's risk of dying from heart disease can climb roughly 7 folds with every decade after menopause. So this is something that we need to be aware of, we as women, because our lives, it is a life dependent, right? Menopausal transition is not only about hot flashes. There's so many things that's changing within our lives. So what you actually do with this information, you ask your doctor for a real cardiovascular risk conversation at your next visit, and not just the checking the blood pressure. Okay, that's all good. No, talk to them. Ask about your cholesterol profile. Ask whether there's this test, the ApoB levels, make sense for you. Does this test make sense for me, doc? Since a standard lipid panel alone can miss that risk factor, the ApoB, that's a test that one can ask for. And then you can see your risk profile based on that, right? You can manage your blood pressure. You can manage your sugars right now. Also, lifestyle changes are important. And also lifting heavy weights. We're going to talk about that a little later. It's so important. But just knowing that you're now during this transition phase in menopause and perimenopause, your risk factor for heart disease has increased, right? So number 4, get your baseline numbers, ladies. Okay. Number 4, it ties kind of directly into number 3, but it's still so important. Know your numbers. Know your baseline numbers. Get that baseline screening done now. Know where you are, right? I want you to ask your doctor about where am I in this baseline? If you're starting to have some of these symptoms, fatigue and so on, then there are certain labs that they might order, right? Your thyroid level. Know where's my baseline thyroid is right now. Where am I? Where is my hemoglobin A1C right now? Am I good? Am I in that, oh, your range is really great, or in your kind of borderline range? Because if you're borderline now, before you enter into that menopausal transition, I'm gonna tell y'all, there's a great chance that menopause, with the hormonal shifts that's happening, that you will go into that full-blown abnormal range. It's just part of the physiology of this midlife that we as women go through. So what's your fasting glucose? What's your hemoglobin A1C? What's your insulin? Your fasting insulin. Are you insulin resistant? Are you becoming insulin resistant? What's going on? What is your cholesterol and your lipid panel looking like? Are you borderline, or are you kind of like, you know what? Yeah, my lipid panel has been abnormal, and I've been saying over and over and over every year for the last 3 to 5 years, okay, more lifestyle changes. But each year you've changed your lifestyle, but your lipid panel is still abnormal. Maybe it's time for you to take more drastic measures, right? What's the DEXA scan? What does your bone density look like? All of that is so important. So here's the frustrating part. Most guidelines, when we talk about our DEXA scan for our bone densities, they're like, yeah, the guideline says wait until you're 65. Okay. Now, once we hit our 30s as women, we start to lose the bone mass. Not in any big amount. It gets accelerated once we hit menopause and perimenopause, but our scan and the guidelines are just wait till 65 when everything is really low for us to be able to check on that. We got to take matters into our own hands. We need to know that bone loss can accelerate significantly during this period of our lives after age 65. So why just waiting for 65 for the first scans instead of understanding where is our baseline decades before we start having this bone loss, right? There's so many risk factors that are happening during this phase, and it's important for us to catch some of these so that we can transition through this midlife process with as little amount of fear and as much data about what's going on in our bodies as possible. You cannot manage what you have not measured, okay? So number 5, lift heavy and jump on purpose. Okay, number 5. Now, I know we talked about knowing your numbers, and this is a perfect time, especially we talked about the DEXA scan and bone density. This perimenopausal and menopausal portion is also the perfect time for us to protect our bones. On purpose, not by accident, on purpose. Now, a lot of times we think about like, okay, we are going to do strength training and we're going to do, this to lose weight. But let's talk about something that is now becoming a little bit more, we're becoming more aware of the ways for us to do this training and to protect our bones as women. So it's important for us to know that somewhere between 1/3 to a half of women over 50 will have osteoporosis and an osteoporosis related fracture in that lifetime. And the hip fracture is something that we hear about, like, such and such fell and then they fractured their hip. Now, the thing about a hip fracture, it's no small deal, other than the fact that it's painful. How do I know? I see it. As an ER, I'm ER trained, so I take care of the patients. Shortened, externally rotated limb, immediately you're like, oh my gosh, looks like an intertrochanteric fracture, right? A fracture right at the surgical neck. But the national data, it shows that up to a quarter of women over 50 die within 1 year of a hip fracture. So that's saying that close to 25% of women over the age of 50 die within 1 year of getting a hip fracture. That's crazy. 1 year. So what do we do with that? Okay, first, I don't want us to panic. I want us to just think about ways in order for us to build our bones. And an important way to do that is to lift. There is a study that was out, a landmark study called the Lift More trial, where researchers in Australia published in the Journal of Bone and Mineral Research, they talked about the way that we in menopause and perimenopause should be exercising. So they did a postmenopausal study on these women with low bone density, and they did it for 8 months. Of course, it was supervised, and they also did thinking about like high intensity resistance and impact program, including heavy lifting, plus things like controlled jumping twice a week for 30 minutes. And guess what, y'all? It worked. Their bone density improved in both the spine and the hip safely, even in women who had already had osteopenia or osteoporosis. So the takeaway is not to go start jumping off boxes tomorrow, CrossFitting, with no guidance. The takeaway is that your bone responds to load. Remember, that was a controlled study, right? So heavy resistance training is not just for the 25-year-old woman who wants the beach body. It's not just that. It's a medicine for the second half of our life. And, it's so important that we're noticing that resistance training and lifting versus just only the high intensity impact workout, the HIIT that we all thought about like 15 or so years ago, that alone isn't it. We need the resistance training and we need to lift in order to help our body and our bones. So finding a way of lifting heavy things safely on a regular basis is the way to protect your future hips and to protect your life, right? Alrighty, so we're on to number 6. Eat more protein than you think. Yeah, I know. This one is so deceptively simple. Eat more protein. Yes, eat more protein than you think and more than you've been doing. So, one of the things that happens during this estrogen decline is that we become prone to losing our muscle mass. And this has a fancy medical term, it's called sarcopenia. And it becomes significant when we get older because if we think about it, our muscles, how they're attached to our bones and our cartilages, right? So a healthy aging person, when you start to lose a lot of your muscle mass, then you start to become more frail and it's easier for you to break your bones, right? So researchers, they began to focus on aging. Generally, they found that for protein, they'd recommend somewhere between 1 to 1.2 grams of protein per kilogram of body weight per day for maintenance, and up to 1.6 grams per kilogram if you're actively strength training or working on body composition. So 1.2 kilograms or grams per kilogram of your body weight in protein daily in order to help to maintain our muscle mass. So if you think about it, the average person is around 70 kilograms, and that's roughly a 154-pound person. So you're looking at somewhere between 70 to 112 grams of protein a day, depending on your activity level, right? But most women, you'll eat probably like less than half of that. You know, we talk about that also with some of my patients who I help with the weight in my weight care program with GLPs. That's also, you know, some of the GLPs, the GLPs itself, the GLP-1 inhibitors, they also have a side effect of decrease in muscle mass. So it's important that if you are taking that medication for weight loss or to help, that you are also ensuring that you are building your muscles and that you're having enough protein intake. Okay? Like we say, it's not about vanity. It's not about vanity. It's about keeping that muscle that makes you strong. It keeps your metabolism working and it keeps you independent as you age, right? And it pairs what we talk about right now, this muscle mass and making sure that the muscle strength and the protein pairs along. And we're talking about the jumping and the resistance training. Protect your muscles, okay? Alrighty, so now we're on to lucky number 7. This is build your team and use the rage. Alrighty, let's talk about that. Now, this might surprise some of you guys. What? Build your team and use the rage? What is Dr. Beckford talking about? Okay, this is what I'm talking about. Do not do this thing called menopause alone. It is such a crazy transition period in your life. You will feel like you are the only one. You will feel that way. Do not use this time to start isolating and withdrawing because you feel like no one understands me. No one else is going through this. I'm the only one that's going through this. Oh my gosh, I can't remember certain things. I'm not as good as I thought I was. Maybe I'm losing my touch. Maybe I'm developing dementia. Maybe there's so many maybes, right? But you aren't the only woman that's sitting here wondering if she's going crazy. So make sure you have a team around you. And yeah, you know what? Sometimes you will get a little bit of rage, but use that rage to do something positive. So let's start with the team. Okay, menopause, it touches your hormones, your bones, your heart, your pelvic floor, your mood, your relationships, sometimes all of that in the same month. You do not need one doctor who takes care of everything. You need a team. So you might need a specialist. You might need a pelvic floor therapist. You might even need a coach or a therapist. But what's important is that you need a community to help you as you further go down that road. So do not be afraid to ask for help. At this point in time, having a community of women is so important. I have so many patients who are going through this and then they talk to their friends who, I mean, they're like best of friends, but everybody was still just going through things individually. And someone just so happened to state something like, oh my gosh, I can't sleep at night. I keep waking up getting like with hot flashes. And then the other woman's like, oh my gosh, I thought I was the only one. No, 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 no. There are many, many women. Or someone might notice, oh my gosh, I keep snapping at my significant other. It's just crazy. I can't stand the fact that they chew and smack their mouth. If I hear that person loud chewing one more time, I'm gonna go crazy. And then they're like, oh my gosh, I thought I was the only one. That's the thing. You're not the only one. There's so many women that's going through this, so don't go through that alone, okay? That rage that's happening, it's a new kind of rage that's happening in the perimenopause and menopausal period. But the anger about the things that you used to just brush off, I know, like right now, it's just like, ah! And yes, it's all due to that fluctuation. It's all due to that mood irritability because the hormones are just going crazy. But underneath all of that rage, there's often something else. It's the first reaction some women, had in order to protect their boundaries in years. So instead of just trying to medicate the rage away or apologize for it, get curious around it. What is that rage telling you? Sometimes a menopausal rage is the thing that's finally getting you to either make that decision and to act on it, right? End that relationship, leave that job, start that business, something that you've been sitting on for decades. Use that as just a thought process of, what is this rage really trying to tell me? Now, am I telling you, hey, every time you get rage, you need to leave your relationships? No. I'm just telling you to sit with yourself and be honest with yourself about where this rage is coming from and what's going on underneath it. And where have you reached that limit? Okay? So don't let the rage go to waste. Alrighty, let's recap. Let's bring it all the way home. So the 7 things to do the moment you are thinking like, am I entering menopause? Number 1, start with having that conversation about hormone therapy. Time is not, it's on your side, but it's also important that once you start early, once you have that conversation, you make the decision, yes, hormone therapy for my symptoms. No, I would used to use non-hormonal therapy, but you have made a decision and you can feel comfortable on that, right? 2, ask about vaginal estrogen. Yes, it's safe for almost everyone. And it is legit helpful. And it's helpful in protecting the vaginal layers. It's helpful in, the lining. It's helpful in helping with the dryness. So it's a little bit more than just dealing with it through that phase in life. Talk about vaginal estrogen. Number 3, protect your heart, because menopause is a cardiovascular event. It's not just a hormonal one, right? Number 4, get your baseline lab screening done. Just have an idea, where am I right now? So for those of you who haven't had like an annual in like 3, 4, 5, 10 years, go ahead, get that done. Know where you are during this particular portion. I don't want to hear from you, well, I don't need to go to the doctor because I'm not sick. I want you to know where you are at baseline, okay? Number 5, lift heavy and load your bones on purpose. Lift heavy, okay? Number 6, eat more protein than you think you need. And lucky number 7, build that team around you, the team that you trust. And don't waste that menopause rage. Let it tell you something. Sit in it and ask yourself, what is this trying to tell me? Okay? So none of these 7 things require for you to wait until you're struggling. I hope you recognize that. This is the whole point of this episode. You are going to be proactive, all right? So if you are in that thick of this transition and you want a provider who will actually sit down, go through your hormonal options, your heart health, your bone health, look at you from a whole picture standpoint. That's exactly what we do at Truly Balanced Wellness Care. Book your complimentary consultation at www.trulybalancedwc.com. The link is, of course, in the show notes. Okay? Thank you for spending this time with me today. If this episode helped you, I want you to send it to a friend. Send it to someone who needs to hear it. She might be sitting there waiting too. I don't want her to suffer alone. Okay? I will see you guys on the next episode, and I hope that this was as informative for you and as fun for you as it was for me. I'll see you guys next time.